Hi, my name is Brenda Hamill, and today I want to talk to you about the Needle Exchange Program. 1 in 10 people struggle with drug abuse and drug addiction. So if you know 10 people, it's more than likely you know someone who battles addiction. Drug abuse is everywhere, and it's perhaps one of the largest, most controversial social issues today. One of the most talked about pieces of drug abuse is what we as a society can do to reduce the harmful effects of it. So for some, that means getting rid of drugs altogether. It's unlikely and impossible to do. A more modern take on this issue has seen the use of harm reduction measures. Harm reduction measures attempt to lessen the effects of using drugs by encouraging safe needle habits and precautionary measures if someone is participating in risky behavior. The most common example of harm reduction techniques are the Needle Exchange Program, and it's also called Syringe Exchange Program. There are many critics of these programs who say that they only encourage the bad behavior, and they create an issue with people who leave their needles in public places. Well, needle exchange programs are necessary, and they help those infected by addiction in many ways. They reduce the amount of diseases associated with drug abuse. They often contain resources to help those abusing drugs, and they save money that would normally be used on long-term care for an infected individual. So to begin with, let's discuss how needle exchanges reduce the amount of disease. Some of the diseases that can be spread through IV drug use are HIV, or human immunodeficiency virus, as well as hepatitis C and other blood infections. This results from when a needle goes into an infected person's vein and comes into contact with their blood. Often it's when the person is injecting the drugs that a small amount of blood is drawn into the syringe they're using and into the needle itself. No matter how well someone would clean a needle after it's used, it's completely unable to be sterilized again. Needle sharing is a common occurrence with those who use IV drugs because needles are expensive and the usage is monitored by pharmacies. So when someone who has a bloodborne illness shares a needle they have with a person who's infected, there's a very high risk that this person will become infected. Many bloodborne illnesses are dangerous because, as many of us know, HIV turns into AIDS, or can turn into AIDS. And while a person with HIV can take medicine to control their condition, even if they come clean or become clean, it won't ever be cured. Even once someone stops using drugs, they can pass that condition onto a potential sexual partner, as well as any unborn children. So needle exchange programs allow those using drugs to come to a safe environment and turn those dirty needles in for sterile needles. That means rather than throwing their needles on public property where anybody can find them, the needles will be safely disposed of. And I don't know about you, but I myself would not want my child or my grandchildren or nieces or nephews or anyone to be walking through a park and look down and pick up a needle. No matter what happens, that's something I don't want to see. But the needles in the needle exchange program can be safely disposed of. It also means that a drug user will have a less chance of contracting HIV if they've not already, and those with HIV won't be spreading the disease to others. So it's a win-win situation for everyone. And as reported by the Courier-Journal, a newspaper in southern Indiana, a study by the Center for Disease Control in Austin, Indiana, the site of one of the most famous outbreaks in the country, found that the percent of those who shared needles before going into the needle exchange program went from 74% to 22%. 82% of those surveyed said they now dispose of the needles in sharps containers. And these are containers that are designed for needles. Of the 124 interviewed, 98% were HIV positive. That means that these people are not throwing their dirty needles on the streets where others can be infected, nor are they throwing caution to the wind. They're not spreading it to other addicts. For Austin, Indiana, this resulted in a drop in the new cases of HIV. In the year 2015, there were 219 new cases of HIV. In the past 18 months, there's only been 30 new cases. So this is a sign that the needle exchange is effective in reducing disease. That's something we should all celebrate. Not only for drug abusers and drug users, but for those who love them and those who inadvertently are infected with HIV. So moving on, another reason needle exchanges are necessary for the many services that they provide. Needle exchange programs often provide more services besides distributing clean needles. They offer free disease screenings, referral services for rehab centers, as well as counseling. In pairing these services with the needle exchange program, those suffering from drug abuse have a safe, non-judgmental place to go when they decide it's time to ask for help. And many of those suffering from drug abuse are willing to get help, but they're not sure who to approach for fear of going to jail if they talk to the wrong person or something to that effect. Those running and working the Needle Exchange Center are in a prime position to build a relationship with drug abusers and drug users. With good rapport and trust, a recovering addict will feel comfortable asking for help. Addiction's really hard to beat by yourself. The Austin, Indiana Needle Exchange Program, they have a center there that's now known as the One Stop Shop. There people can get counseling, they can get clean needles, and blood screening. But they also know locations, times, and dates of local recovery groups, and they can assist in referrals to doctors and clinics that will help with their detox. Though it's only open a few days a week, you wouldn't believe how incredibly busy and how often it's filled from opening hours until close. Many of those participating at different stages of recovery, and they help others along the way. This approach met addicts where they were and helped them in their recovery on their own terms, in the best way suited for them. So if through this we can empower even a fraction of addicts to regain their lives, is it not worth it? Lastly, needle exchange programs are more cost effective to the government than long-term care of an HIV positive individual. Many of those with HIV come from low-income areas. If they're using public assistance such as Medicaid, the government will have to pay for their care of the individual either until they find a job or for the rest of their lives if they become disabled. And with HIV, that's a very good possibility. According to the Center for Disease Control, an annual $10 million invested in a needle exchange program would save over $75.8 million that would have been spent on long-term care. So we're facing a public health crisis with HIV that will only rise if it's not treated. This means that the money spent to treat these individuals also rises. If we reduce the number of cases being spread, our spending on the care lessens. It may seem harsh, but it is economics in a time when our government doesn't have money to squander. So in conclusion, needle exchange programs are necessary, and they do help those suffering with addiction. Needle exchange programs reduce disease. They provide access to services and reduce public spending on long-term care. When it's easy to discard the importance of these issues, it's much harder to wave away the fact that 1 in 10 people will suffer from addiction. And regardless of what someone has done, that 1 in 10 is loved by someone. Maybe, just maybe, that 1 in 10 is someone you love. Is it not worth offering them what help we can give? Thank you.